Today we have with ourselves Dr. Kajal Patel. She has got All India rank 1547. And very unique thing about her is that she has done USMLE step 1, 2, and then rotations, and then did rotations in US, and then decided it was not that for her, and she appeared for NEET and she got this rank. So Kajal, please introduce yourself.
Hi, I'm Dr. Kajal Patel, and I've done my MBBS from Medical College, Baroda.
Okay, so how was your UG life?
UG life was like everyone else. I did study sincerely in the first year, and then second year was not so good, and then again in third and finals, I did start preparing for NEET while considering if I wanted to pursue the USMLE pathway. And then so I could finish the RR videos of final year subjects, and then again in internship I decided that I wanted to go for steps.
Okay, why you wanted to, in the first place, wanted to go for USMLE?
I mean, I thought that it was the lifestyle, and okay, so the reason was that I used to watch a lot of Grey's Anatomy, and I found that maybe that kind of life is better suited for me.
And what happened in rotation that broke such thought in you?
A lot of things, when we used to attend wards here, and we used to interact with patients, and a typical OPD here in a government setup sees around more than 100 patients a day, right? And then I was posted in infectious disease, so that is a subspecialty itself. And then we used to see only 4 or 5 OPDs, that to teleconsults. So I didn't find much satisfaction in that.
Okay, so
So
where were you doing your rotations, in which hospital?
so I was in Syracuse, upstate New York. So
Okay,
that was upstate university.
okay. So you gave INIs in this time?
Yes, so I did come back in July last year, and then I started preparing. So the November INI I appeared for that one, and then I got a rank of 2.5K. And so my main goal was always NEET PG, because I wanted to go for colleges in my state. So I and even after that I couldn't get, I wanted pediatrics, and I was not going to get pediatrics with that rank. So I kept studying. So my main sources were the since I was like thorough with RR content in my final years, I just went through those notes, and then I solved custom MCQs and PYQs, and all basic things. And then I went about just doing more custom MCQs. So I was not happy with my rank, and then came the next INI set. I Like a lot of us, I was very shocked because my rank went down from 2.5K to 6K.
Okay.
When you would expect that
Yeah.
it would go up. Um, so after that, I decided that I would now seriously prepare for NEET, which was in
23rd
sorry,
June.
I just zoned
Firstly,
out.
okay, firstly, it was 23rd June and then postponed to 11th August.
Yeah. So I had gotten a BTR subscription, and since I was very thorough with RR, I used to mostly final years I did from Marrow, and I did a lot of subjects from like my favorite faculties across all platforms. So then I started following BTR religiously. I did everything. I did active recall of both the copies, and then I did the ENDs, and I gave GTs. I gave GTs one every week.
Okay.
So
So how was your rank like
yeah.
in GPs?
So initially in July, my first GT, I managed to score only 350, despite all my basics from step 1 and step 2. I am very good at first and second prof. You know, the path, micro, and everything that gets very beautifully covered in first aid and USMLE material. And despite that, I could only score 350 because the GTs and NEET in general is a very you know knowledge, what can we say, memory based. They test a lot of memory based stuff, which was not covered. And then my graph began, slowly it began to rise. But still, until 1 month before NEET, I couldn't cross 600. It was just, between 500, 550s, 570s. And it was that one GT before the tentative NEET, which didn't happen. 1 month before that one, I got this. And then just, that gave me a confidence boost. And then it was uphill.
Okay, okay. So, which branch are you aiming for?
I was very strongly clear since my final year that I wanted pediatrics.
Okay.
And so after my internship, I couldn't study much in internship, so I had to take my step 1 and step 2 after I finished it. And then so I had a lot of time, and I did 1 year of job in a pediatric private setup. So
Where?
then I was in Ahmedabad, where I stay.
Okay, okay. So, what was difference like in US versus Indian setup? And according to you, why India is better than US?
So there were a lot of other factors also, like the weather, the food, and everything, the lifestyle, which didn't suit me. But if we talk about medical practice, um, the doctor to patient ratio is better there. So you get more time with patients, but then they they spend a lot of time on one patient, and then they see 4 patients in a day, and the rest of the day they use for charting and patient notes. So I was sitting there one day, and there were glass windows and there was sun in my eyes, and I was making notes for 4 hours at a stretch. And I thought to myself, I couldn't do that. I needed to see more patients. And you know um, yeah, just because I had seen such kind of practice in where I studied in a government setup, so that, I don't know, I thought that that was better suited for me.
Actually, many people, because of such a many of the things that occur in our country, they become frustrated, and then they like, kind of try to migrate to other country, and thinking that the grass is greener on the other side. But actually, when you go there and feel, then you come to understand what the impact of that decision would be on your life. So it was really,
That's actually very true.
so
Yeah.
it was really this thing that people should realize before jumping onto the conclusion that we should migrate or not migrate. So
Very true.
yeah, you say.
Yeah, but then what do we know when we are just undergrads?
Yeah.
So it's very good if you have that clarity. But then again, I've gained experience, and so I mean, I'm 2 years late, but I don't think that makes much difference.
No, no, it
So
never.
it's a win-win either way.
Yeah, yeah.
Yeah.
So you said that your GT scores were not that good. So how you kept yourself motivated during that time?
The motivation was that this is not good enough, and crying over it is not going to help. So I just used to, go through the wrongs and then quickly brush up the correct ones. And then I used to see where I was going wrong. But then again, um, you can't know from one GT where you are going wrong. So you just keep reviewing what you are reviewing, and then eventually it gets better.
Okay, you were saying you used BTR and you in final year used rapid revision. So when you switched from rapid revision to BTR, were you copying some of the notes from rapid revision to BTR, or it was like you kept the whole of rapid revision in cupboard and you were focused only on BTR?
The thing with BTR is it it covers most of your PYQs. So when you solve PYQs, you will feel like you know everything. And then you solve GTs and you feel like you don't know much. But then I had the RR. I did the RRs very diligently, so I had it all inside. And with MCQ practice, I did annotate a lot of stuff, but not from RR. I did annotate from like the custom MCQs that I solved. And when I'm doing one subject, I used to just make for example, if I'm doing physiology, I would pick the systems from physiology, and then I'll use the tags NEET PG, INISET, and so those tags I would use, and I'll make sure that all the PYQs that were in that app, I'll go through them once through custom MCQs. So if there is a subject, I wouldn't have even one MCQ that I missed from PYQs. And then I used to annotate. Of course, there would be some, points that were missing. So I would add to that. And in the end, it was a big khichdi,
Yeah.
but it was very much worth it.
So you
So
kept BTR only as a source and annotated from all the other sources to onto BTR. So
yeah. So basically,
yeah, yeah.
sorry, continue.
No, no, you continue.
So I did follow everything that ma'am said. She asked us to do active recall. I did active recall of BTR. Bonus I didn't do. Then I did all ENDs. I reviewed them. I also annotated everything from ENDs into the BTR and bonus BTR copies. So in the end, that was the confidence that in the last week, even in the last month, it was getting very difficult to review even just two books. But then when you annotate stuff, it's because of that fact that you annotated it, you remember it. So it's not going to help if people are using just PDFs, because they haven't listened to the lecture first of all, and they haven't annotated. So just BTR and bonus are not enough. There are a lot of compiled modules, and then there's a lot of mega neat BTRs and choti copy sessions. It's a process, and it's not just content. You just need to build layers, like ma'am says. We just go through one step at a time, and we build on that. So I did like that.
So how was your like choti copy? It became moti copy or it was a really choti?
I made a very beautiful choti copy. I did like highlighting and stuff. I was never a notes person, but then this workbook, it's so beautiful, and the whole process of annotating and everything. So I made a choti copy, which I made in the last month, last 2 months actually. Because if you make from the beginning, there's no point actually, because you don't know anything in the beginning. So I made in the last 2 months. It was a diary, like a small notebook. It was a choti copy, but I didn't even review that one. I couldn't. I just didn't have the time. But I think you making that choti copy, the fact that it helps you, because you have written it. So there's that muscle memory.
Okay, maybe that was the reason that saw your rank jumping in INF to NEET, that you did choti copy and all. Great.
Yeah.
So, what message would you like to give to your juniors?
Um, First of all, I would, if someone is in first year, I would like to suggest them to go through good books. I used Robbins, and that helped me. And I wish I should have gone through, the standard textbooks of other subjects too. So, and in INISET, they ask a lot of questions from, profs. So you won't find those questions in your notes. Even in like sometimes main notes also, you won't find those questions. So if your concepts are good, you can start preparing from third year. So there's no rush. And another message is that I learned very recently is that solve more MCQs, because no matter how much ever you read, how much ever you memorize, it's not going to help. But that one MCQ that you solved, it's going to stay, and then you'll remember how you solved that one. It's sometimes it's just magic. You don't understand how you come to some answer, but then that is stored as instinct. So more even when the exam got postponed, I thought I was very well prepared. I was getting in 600s, and then I was very well prepared. But then I thought, what would I do with one extra month? I could review again the like both the books and everything. So what I did was I did 100 custom MCQs every day, random, and also I did all FMG PYQs.
Okay, so all
I
those
just had so much time.
so all those things helped in you getting that score.
I mean, I thought FMG asked just basic questions, but there were good questions too. So why miss those?
Okay, okay. Great, great. It was really great having you on my platform, and wishing you best of luck for your future. And thank you.
Thank you so much. You are doing commendable work on the channel, and yeah, we would like to see more videos.
Okay, great, great. It was great having you.